Welcome, everyone, to today's webinar, Why Online Reviews Matter to Potential Patients and Your Health System. My name is Brian Zimmerman, and I will be your moderator today. On behalf of Becker's Healthcare, thank you for joining us. Before we begin, I'm just going to walk through a couple of quick housekeeping instructions. So we'll have time at the end of this webinar for our audience question and answer session. And you can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link used to log into today's webinar to access the recording. If at any time you don't see your slides moving or have trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box, and we'll be here to help. So with that, I am pleased to welcome today's speakers. I'll let them both introduce themselves before we dive into our discussion. Brian Oram, AVP of Strategic Sales, Healthcare, Podium, and Jay Kinzel, Senior Director, Business Analytics, Concentra. Brian, you want to introduce yourself?
Yeah. Hey, everybody. It's great to be here. I'm, again, Brian Oram, AVP of Healthcare. This has been my passion and obsession for the past 3 years here at Podium, and very excited to speak on this topic.
We're excited to have you here, Brian. And Jay, why don't you go next? Tell our attendees a little bit about yourself.
Thanks, Brian. Yes, my name is Jay Kinzel. I'm the Senior Director of Business Analytics at Concentra. We are a healthcare provider that specializes in occupational healthcare. So somebody slips and falls at work, we make sure they get back to work safely and quickly. And dealing with our company's survey program and reviews has been my obsession also for the last few years, and glad to be here with you guys.
Great. So let's go ahead and dive right in then. The first question I have for each of you is, patient reviews directly impact the online presence of health systems. What is the responsibility of the healthcare system in this sort of interaction? And what should they be doing?
Brian, you want to go first?
Yeah, I'll hop in there. Absolutely. So I think it's a few things. I mean, one, really the goal of any, peer review is to represent a typical experience, that a patient goes through with the care provider. So the more reviews likely means that the experience is properly being portrayed or represented online. And what we see today is a bit of a different story. So typically in healthcare and specifically with healthcare organizations, how they're represented online is often more geared toward the negative. So typically those that'll go online and leave a review today are either, disgruntled patients, those that maybe had a poor experience, which are typically in the vast minority of patients that have visited. But then you have this other pool of patients who typically, unless they are avid reviewers of anything and everything that they visit, typically don't take the time to leave a review. Maybe they don't know how, maybe they get busy, or maybe they just don't think to, right? And so what it creates is this tendency for, especially in healthcare, for healthcare organizations to be rated lower than maybe they should. And it also just doesn't provide an accurate portrayal online of consumer confidence, of patient expectations, and really establishing a proper benchmark for that healthcare organization online. And with the digital front door and the consumerization of healthcare being absolutely critical to optimize for, healthcare organizations are really trying to basically come up with a way to solve for this, right? Because patients are taking it upon themselves to perform the search, to find a care provider that they can trust, or find a care provider that that they want to do business with. What they're doing more so than ever before is they're going online, they're viewing the reputation, they're viewing the reviews, they're viewing the actual overall star rating that's provided on Google or Healthgrades or Vitals, et cetera. And what they're seeing is often not a very accurate depiction of what that healthcare organization portrays. Jay, what would you add to that?
Yeah, you're right on. I would say the thing is you've got an online presence whether you like it or not, right? It's out there, and so I think it behooves you to manage that. I view the reviews as often the beginning of your relationship with your patient. That may be the first thing they see, whether they're Googling you specifically or just more generically healthcare providers in their area. Google is often the very first thing they see, and we all know first impressions matter, right? You're setting the expectation, as you mentioned, Brian, for what that experience is going to be like, and the reviews help do that. And it's just, it's the way people are purchasing everything, where consumers are more informed. Ratings are important. We all do it. You go to Amazon, you buy a camera, ratings matter. You go to, a breeder for your dog, ratings matter, and it certainly applies to us in the healthcare space as well. I think the important thing is you have to, since it's there, you have to pay attention to it, and you have to be proactive. And I think it also gives you a sense of, what are the patients thinking, because they're leaving those reviews, and gives you, an operational advantage if you can take some of that. Some of it might just be disgruntled patients, but there's also going to be some useful information that you can use to improve your operation. You have to approach it the right way, right? Not in a defensive way, but in a take it as constructively as it can. And not all the reviews are constructive in the way they're written. But you can still use those to your advantage. But the idea to me is put that best foot forward and make that first impression a positive one. I think that's really important.
Absolutely. Yeah. And to your point, Jay, the taking a proactive approach is absolutely critical, right? Because just leave it to kind of typical trends. What happens is often a negative portrayal of your brand or your organization, when actually the care that you're providing is typically, top notch. So I totally agree there. And the other thing that I would call it based on what you said is just how important Google really is. I mean, the majority of search traffic, especially in healthcare, is occurring on Google. And the first thing that they're going to see is how you're rated. The first thing that pops up is your organization name with a star rating. That is the first thing that they're typically going to see when they Google your organization. And so, yeah, you're right. It's critical to take a proactive approach to solving for it. And not just because you want to be rated higher as an organization. Obviously, that is absolutely critical. But the other piece, like you said, is gleaning information from your patient reviews to improve operationally. I can think of several instances where, we've partnered with different healthcare systems and healthcare organizations, both in, the traditional health system world as well as in retail healthcare, where, they were able to use that operational data to actually enact change that then improved things for their patients, improved things internally, and ultimately improved their rating over time as well.
Agreed.
So I'm struck by, Brian, your comments there around, rankings and how you show up and appear in Google. Can you talk more about that? Can you talk more about how reviews sort of impact search rankings and what patients see right away? Can you get more specific on that?
Yeah, happy to. So, Podium, and I guess I failed to introduce Podium too much, but Podium is a premier partner of Google. Google Ventures is an investor in Podium, and we've been at this for quite a while. What Google uses in their ranking system in any search, so especially in a local search. So anytime you're typing in the search for best doctor near me, best urgent care near me, best hospital near me, best whatever clinic near me, Google is going to use a certain algorithm made up of, relevance, data, location, geo, as well as reviews. And inside of those reviews, there's really four things that matter. It's your overall average rating, your quantity of reviews, the recency of those reviews, and if you're interacting or responding to those reviews. And that ranking is absolutely critical. I mean, what the makeup there determines if you're ranked in the top 3 or lower. And the reason the top three is so important is 98% of local searches are going to include a map pack, meaning there's going to be a map on your phone or a map on your desktop. And inside of that map pack, there's going to be 3 recommendations based on a rating, right? Now, the other thing that occurs here is what we've seen over the last few years is a 400% rise in the amount of near me searches, as well as in the amount of best near me searches. So when a consumer, a potential patient, when they type in the search engine, best provider near me. So let's say they type in, best family practitioner near me or best urgent care near me, which we see all the time, right? So best urgent care near me, what pops up is an automatic filter that Google includes in that search result to filter out anything below a 4.0 star rating. So if you don't have a 4.0 or above, you don't even get to play. Like you don't even have a shot at converting that consumer into a potential patient, right? Because they're not going to see your business listing. All they're going to see is, 3 options, and then as they scroll, a few more of relevant healthcare organizations that fit the criteria of urgent care or Instacare, right? And it's going to be anything above a 4.0 star rating. So absolutely critical that we optimize for, the way that Google looks at ranking. And again, for Google and really for any other type of search provider out there, their goal is to provide an optimal consumer experience. Like you think of Amazon, the reason that they rate all their products and the reason they encourage you to rate the product that you just received is so that they can encourage consumers to buy products that everybody else is happy with, right? More people are going to use Amazon that way. And it's similar for Google. Google wants to provide recommendations to consumers that consumers far and away recommend, which is why that's so critical.
Thank you so much for diving into that there. Jay, do you have anything to add on that? Any other insights from your point of view?
Yeah, Brian covered, I think, the important things, and just want to emphasize the importance of that map pack can't be overstated. That's where decisions making, whether it's conscious or subconscious, is already starting at that point. Whether they choose to even go any further past that, a lot of people don't. I know there are many cases I don't go past that. I Google Thai restaurant near me, and I get a map pack, and all right, I pick one, and I move on. So that's really important. And organizations, a lot of them have spent a lot of time and effort on their website, for example. And everything we've been talking about happens before the patient even gets there, or prospective patient even gets there. And so you want to drive people to your website. That's another step in the consideration process that a patient is going to go through. But you got to get them there before they can even see the fruit of the labors that have been done to improve websites, improve the experience on those, and so reviews are going to be the key. And as Brian emphasized, it's not just quality, it's not just quantity, it's not just recency, it's all those things. So it's not something you can just set it and forget it. You have to continually be proactive and making sure that that you stay up. It's not, oh, I've got 12 5-star reviews, I'm done. Because if you leave that alone, first of all, the 5 star is going to go away, your recency is going to go away, and all those things matter. So even though Google can sometimes seem like a black box, there are certain things you do have control over. And things you can influence, and reviews is one of them. Not that you're literally controlling them, but by being proactive, you're encouraging the more positive reviews. The folks that are going to be negative towards your business, they're going to find a way to get their voice heard, right? They'll go, and they may even go out of their way to do that. But you got to make it easy and be proactive with the people that like you, and they'll be more apt to do that. And then you appear in that map pack, you appear in that early decision-making process that a potential patient is going through, and that's only going to drive more business to your company.
It definitely makes a lot of sense. I think the idea of like having 12 5-star reviews versus somebody that maybe has it maybe has a 4.5-star average rating but has 1,000 reviews, right? Like it's just like as a consumer, that logically makes sense to me of what I might be more gravitate towards. And then thinking about this proactive approach, that you've been talking about. I think it is a lot of that, contingent upon really getting more reviews written, right? Getting more of your patients to engage and write those reviews. So what can health systems do to increase the number of reviews patients write? So, that sample, that segment that Jay, you were talking about of the patients that are, less satisfied isn't overrepresented.
Yeah, so there are several things. First one, and I've mentioned it already.
Jay, do you want to take that one?
Proactive. Yeah. You've got to be proactive. As I've said, what does proactive mean? So proactive doesn't mean we just sit and wait and hope we get good reviews. It means reaching out to your patients. What we do with our patients is every patient that comes through the door, they'll get a survey via text message. One question, that's it. If they respond to the survey, regardless of the score, even if it's a low score, we'll send them a link to Google, to the Google page for the center that they went to, and all they have to do is click on that link and they can leave a review. It's very easy, and so it's got to be something that's simple. People are going to do it. They have to be able to do it on their phones. Or some patients might prefer email, but for us, we've definitely found text message is way more effective. So you make it easy. Don't get greedy on the survey side is one thing, and this is a mistake I made early on when we were testing this. We tried to ask a bunch of questions. We tried to ask 5-6 questions of a person and then send them a Google review. Believe me, you've lost them by that point. We now ask them one question. We ask an NPS question, would you recommend type question. But wherever you head with that, don't get greedy, because you're going to, every piece of friction that you put in the way of the patient and leaving a Google review is going to get in the way. So don't get greedy there. And you have to read and respond to your reviews, which sometimes is hard because sometimes they can be inflammatory, those types of things. But you've got to get out there, respond to those, even if they're negative. Don't get in fights with people online, right? Keep it positive, invite them to an offline discussion. And there are lots of best practices around how to do that, but obviously keeping that professional and being active. Again, to me, it's all about being proactive and making it easy. And as we see this in other businesses as well, right? I go to the AT&T store to, get a new cell phone plan. I get a survey, I took my dog to the vet. I get a Google link. Hey, thanks for coming in and bringing River to see us. Can you leave us a review? And so it's super easy, and I'm apt to do that. So I think, being proactive, and interacting with his patients, and just, the ultimate thing is it's got to be easy. It's got to be there for them. They can't have to go to a different site. You can't wait for them to search you out on their own. You have to, in a way, serve it up to them. They can then write whatever they feel is the right review, but you've given them the tools and made it just an easy process for them to, reflect the kind of good care that you've provided for them.
Thank you, Jay.
Yeah, and I mentioned, sorry, I'm getting some feedback. All right, are we good? There we go. Yeah. Awesome. Thanks, Jay. So I love that. And Jay, I think, that is absolutely spot on. I think there's a few things that are absolutely critical, and it's something that obviously your organization has done a tremendous job of. And I would agree on the over surveying piece. I think it's easy for healthcare organizations to dive so far into the survey that if they put those two touch points together, the review ask as well as the survey ask, if you're not careful, you'll never get the quantity needed. But again, I mentioned that this has kind of been my obsession for the past several years, and it's been Podium's obsession for the last 6-7 years. It's the reason our company was founded, and, has been why we've been such a fast growing company. But really what we have been so focused on is being able to provide a way to do this in a way that scales. So for healthcare organizations, I think one of the biggest problems isn't that they know they need them, right? So it's not that they don't know. It's more that bandwidth of figuring out how do we actually ask and collect reviews at scale from patients is just such a daunting task. So often they'll revert to, little cards in the entryway or like a little QR code, like, hey, scan this and leave us a review. And it just doesn't, as great as those ideas are, it just doesn't actually produce the benefit that you're looking for as a healthcare organization. So it's critical that that you take an approach of automating the ask. So, for example, providing a way to integrate with the EMR or with the practice management system so that we can send out an automated ask to a patient. Jay, you touched on the importance of text messaging. 8% of text messages are read versus 20 some odd % for email. So just the overall reach is greater with text messaging, but also the convenience factor, right? As a patient leaves, they get a quick text. It links them to a review site and they're done. 15 seconds later, they move on with their day. They've left positive or negative or, honest feedback for that healthcare organization, which in turn, done at scale with a large portion of your patient base in an automated fashion over time, creates just a massive wave of the reviews that you need. And then at that point, it's your true patient base and their voice is heard. Which in turn, what we see with healthcare organization after healthcare organization, the majority of our partners see, an average rating upwards of, in the mid to high 4 range, which is where you need to be if you want to be considered as a recommended healthcare organization, especially when people are doing that best search, right? So automate the ask, include the link to the review site. And then make sure that you're engaging with these patients and that you're utilizing the review data to take positive action. So, Jay, I couldn't agree more. And obviously, I think that the approach that you've taken has been obviously very beneficial, but also something that's allowed transparency to take place in the organization at that digital front door, which is so critical to optimize for because, the majority of consumers are going to search on Google. 88% of consumers are going to look at reviews before they make a purchase decision. So it's just absolutely critical.
Yeah, and you brought up the part of scale is really important, and obviously in the medical community we have a lot of different sizes, and so this for us we have over 500 clinics across. I think we're in 45 states now, so we had to be able to manage that across many different centers, not just one. And the thing for us, before we launched the program where we are now with the text messages and the Google survey links, we were calling people literally on the phone. We had hired a third party, but there was a call center of people smiling and dialing all day. And what we noticed, and first of all, talk about scalability, not scalable. Phone calls over a large scale, very expensive. And you don't get nearly the quantity of data that you can get through text messages. But that was the way that we made it easier for the patients and then made it easier on ourselves. And now we have that scale. We get a lot more information now. And to be honest, we're not bothering people as much. A text message isn't nearly as invasive as a phone call. So I encourage you to, think about this in very much in a retail mindset. How think of it as a consumer? How can we remove friction from the process? How can we make it easier on our patients? And we do this, we're trying to do this throughout our business, right? Medical care is growing in leaps and bounds. Telemedicine. I mean, just yesterday I had a telemedicine visit for my daughter who had a concussion from playing lacrosse, and that type of thing is going to change as well. And so there's definitely a move to make it more consumer centric, retail centric, and making the reviews follow that is just as important.
Yeah, absolutely. Jay, I'm curious. I'm curious, Jay, how, and sorry, there might be a delay on my mic. Apologies. But Jay, I'm curious how, if your organization was a bit nervous to sort of open up the floodgates, so to speak, of messaging the majority of your patient base to request a review. Because I think sometimes, when I consult with health systems and, healthcare organizations, they get a bit nervous because all they're seeing right now online is a bit of the negative portrayal, right? And so the apprehension in doing something like this is, gosh, if we ask for reviews from the majority of our patients, are we just going to get more of the same, or is this actually going to make a difference? So curious what your feedback would be there.
Yeah, we were very nervous. I was very nervous at what we were going to get. We saw, as I mentioned, we have now over 500 centers, and at the time, many of them had single-digit numbers of reviews, and they might be 2.3 stars. And fast forward a few years, we're now sending millions of text messages a year. And we had the conversation of, what if we send all these text messages and we get, rather than 10 reviews on this total website, we get 1,000 and they're not what we hoped for. We felt so we definitely had those conversations. What put us at ease was the phone call surveys that I mentioned before that weren't effective as far from a scalability perspective. They were effective in telling us that our patients liked us. In general, we were giving a good experience to our patients. The Google reviews simply weren't reflecting the quality of care that we knew we were giving. So ultimately, we went with, okay, we trust our surveys. We know we've been doing them for a long time. We have years and years of history. And if we make it easy for the people who do like you, which we found out was by far the majority, the vast majority, that the positive will drown out the negative. And we piloted, with a dozen centers, and it was overwhelming, the amount. And like I mentioned before, we send the link to even people that give us a low rating on the survey. And that was a topic we debated as well. Well, are those people, will that just lead to more negative reviews? But again, those people are going to seek out to have their voice heard anyway. But by far and away, we saw that the positive outweighed the negative. And we now see where our Google reviews, over 4 match what we knew we had in from our surveys, and there was that disconnect. And so we've helped bridge that gap. And this matters not just to patients; it matters to potential employees, right? People don't want to go work for a company when they see 2.3 stars on Google reviews. So it even has further implications than just patients. It matters, and I know our operators in the centers, that matters to them. They go on Google and they see what patients are saying about them, and that's a source of pride for them. And so it really has a wide-ranging effect on the business.
Thank you both for best practices there. And then also a great follow-up question, Brian, diving into that I think was really important. We've had so many great audience questions come in, so we've got a really engaged group listening in. I want to ask one more question before we move to those. So looking forward now, what should we expect to see in the future online presence trends in healthcare? What's coming next?
It's a great question. I think the consumerization of healthcare over the last 5 years has really proven that transparency and the overall patient experience is what wins. That's what differentiates healthcare organizations more than anything else. It's the more and more peer reviews that you have available, the more transparent the organization, or perceived transparency to the patient as well, the better. The more you can the more feedback you can collect, the better. And ultimately, the more optimized and consumer friendly you can make your patient experience, the better, right? I think there's so many points throughout that patient journey that cause friction. There's so many different communication touch points that you can receive. And there's so many different, you get your bill in 3 different ways, right? And the way that you pay it differs depending on which provider you saw or which specialist came in during your visit. Like there's just so many things that can cause a bit of a disjointed experience in healthcare. So the more seamless we can make it, the more consumer friendly, the better. And ultimately, like speaking to the importance of your online presence, that is only heightening. So what we're seeing is, a 400% rise in the amount of searches taking place for healthcare organizations near them. But within that, like we're seeing that more choice and more convenience is really what people are looking for. And so I see that continuing. I think that's what consumers are looking for. It's what consumer behavior has taught us over the last several years. They're looking for convenience and they're looking for an optimal experience. And they're using your reputation that they see to communicate to them what type of an experience they can expect.
Thank you, Brian.
That's right on, Brian. I would agree. And I would say, it may be obvious, but I'll say it. The reviews are going to continue to grow in importance. I think we're just at the beginning of seeing the impact that reviews have on medical systems and providers. It's going to continue to grow. There's been, I would say over the last 5 years, there's been a continuing emphasis on the online presence and mostly around website development. And that part has grown a lot. But I think we're at the very beginning of where the reviews are. I wouldn't be surprised if we see some consolidation in that area. Google is kind of king of reviews, and that may sound strange but it's true even of restaurants, hotels, all those things, and even in the medical community. But we're going to continue seeing this more importantly, become more important. I think you're also going to see it not just with new patients. So most of what we talked about is someone who's trying to find a healthcare provider. I think you'll even see this with existing patients. Hey, I'm going to go check out my doctor and see where they are. Oh, there's someone better. And so you could look at possible churn if losing of your patient base. So even if you're an established provider with a great patient base, I don't think this is something to be ignored, because there's too much information. When they're going to Google you, maybe it's just, I forgot their phone number. I'm going to Google them and find their phone number. Oh, the rating is right there. So it's going to be staring them in the face. So I think that those types of things are just going to make it more important that you're, being proactive. I think there's going to be improved intelligence in the medical system community of what is a good review. And Brian touched on a lot of these things. What it takes to get a good review. Less friction in the system. Just a smoother experience. We all know less time in waiting rooms, right? Some of those things, that we've known for years, but there will be more information that we can glean from those and get ahead of the issues that our patients are seeing. And I think that can only help us as in the medical community to provide better care and provide more targeted care to what's important to the patient, because sometimes there's a disconnect, and we don't want there to be. We want to provide the patient with the experience that they're hoping for, and reviews can help do that. The more feedback you're getting, the more you're going to know, how do my patients really feel about the services and the experience that they're getting, and that's just going to continue to grow in importance.
Totally. The level of engagement we're seeing from attendees right now is sort of indicative of that trend, that this is going to be growing in importance. I think we've had so many great questions come in. I definitely we'll get through as many as we can. So let's go ahead and dive in. And as a reminder, you can type those questions into the Q&A box you see there. I think most of our attendees have figured that out, judging by the volume of questions we've gotten. So I'm going to open up with this one. So the attendee asks, how have you handled responding to reviews? Who does that in your office, and what do you do about negative reviews?
Well, for us, we do respond to reviews. We don't respond to all of them. We'll get several thousand in a month, so we don't respond to all of them. We do respond to positive and negative reviews. At this point, we respond mostly at the corporate level. And then we funnel problems to the local providers as appropriate. If there's something that that needs the attention of the local provider, we draw that to their attention. Again, we try to pull any disagreements or negative reviews. Hey, let's take this offline. Let's talk about how we can help you. Sometimes people don't want to be helped; they just want to get their pound of flesh and leave their comment. But for those that that you can help, sometimes it's miscommunication or misunderstanding of expectations, and so we want to have those conversations. And so we just try not to have that as much in public, and obviously following best practices of keeping it professional. And and doing those things, but we're still. I think that's evolving how we're going to respond to those. But we do have someone who reads those and responds. And as Brian mentioned at the top of our session, the interaction with the reviews matters. So not just obviously it matters. Patients want to have that interaction, but it matters to the map pack, to the algorithm, and those things. So it's a kind of an objective and subjective reasons for responding to reviews.
Definitely. Thank you for there. I think that'll be very helpful for attendees to know just how specifically you address how the process works. The next question we'll take is the attendee asked, we've implemented strategies to request reviews in the past, but we don't get a lot of traction. What should we be doing differently?
Yeah, I can speak to that. I consult with health systems that have tried to tackle this for a number of years. So typically what we see, and again, I think we would probably have to understand fully the type of implementation or the type of effort that has gone about here. But typically what we see is there's not enough automation in place or a seamless or frictionless flow to complete the review process. So something that we have been absolutely dialed in on for years now is how can we make it absolutely seamless? So when a patient gets the text, number one, how close is it to their visit? Was it actually based on a visit that occurred, right? Which is where the integration piece comes in to play with the EMR. But beyond that, when there is a link in the message, can they click it and can it just pop up a window that automatically logs them into their Google account? They can post it and be done? Or are there multiple pages that load? Is there a login process? Like the more steps involved, the less likely you are to convert that review. So what we see a lot of times is people will try to grab short code off of Google and toss it in there, and there's multiple page loads and it takes a lot of time, and then it'll require them to log in. And so there's a lot of friction in that process, and the more frictionless you can make it, the better. So what I would recommend is an automated process with the least amount of friction. So some sort of, like in our case, we do have a specific widget utilizing Google APIs that allows that conversion to take place, but any sort of effort where you can do it at scale and do it as frictionless as possible is definitely going to be the way to go.
Thank you, Brian. And this next question is sort of in a similar vein. So just asking you to push a little bit further, perhaps, on what you just shared. But the attendee asked, what programs do you recommend to help maintain your online reviews?
Yeah, Jay, do you want to take that one, or do you want me to take that on?
Yeah, go for it, Brian.
Okay. Well, I think I'm a bit biased here because I do work for Podium. And Podium is an online reputation management solution. So I think, definitely that there's a conversation to be had there. But beyond that, there's a lot of tools that you can use or a lot of listings and third parties to pay attention to, right? In terms of what you use to actually manage those, obviously I have a biased opinion there, but the listing sites to pay attention to, especially in healthcare, are going to be, Google, which is where 60-70% of all healthcare searches happen. But there's also other sites that are pretty important, like WebMD or Healthgrades or Vitals. We do see Yelp, although we've seen it diminish year over year in terms of its importance. But yeah, so definitely platforms that can provide a holistic approach and one that solves for the major players in the space and provides a way for you to not only be able to automate the collection of those reviews, but also manage those reviews at scale. So does the platform allow you to respond to those reviews? Does it allow you to receive notifications of new reviews? Does it provide dashboarding to allow you to track your progress and compare region by region? That sort of thing. Like, that's the type of recommendation I would make in this case. But Jay, I would love your take on it.
Yeah, I think, and you mentioned in the previous question about automating as much as you can. I think that's really important, and not, your front offices, all of them are so busy. They're not going to have time to, I've got to remember to hand a survey card or a QR code or something. So I think that's important. The platform, to me, and what we've seen is Google is by far the most important, probably then Facebook next, at least for us. We still get interaction through there. Yelp, we see little to no real interaction going on there, and I see that continuing to decline. But and it's hard, and social media as a whole is growing. So your Twitters, Instagrams, those types of things are growing in importance, and those may not even have specific review type of things, but there's mentions, and then there's followers and those types of things that can have an influence as well. And whether we like it or not, we kind of have to have our pulse on all of those things, and they change quickly.
Thank you both so much for tackling that. Some important points there as well. And the next attendee question we'll take sort of goes back to how we concluded our initial sort of discussion, thinking about the future, right? Future trends. So the attendee asks, online reviews tend to focus on the interaction between a consumer and a provider. Do you foresee a time when online review sites will allow consumers to rate their experience with the healthcare system's administrative side? For example, appointment scheduling, billing.
Yeah, and I would say at least for us, we're seeing that already. And again, by looking at reviews, we'll see. Dr. X was fantastic, but it took me too long to get my results, or I waited too long, or scheduling follow-up. So that's already starting, and we're already seeing that. And that's, again, I think, if you take those things as constructive feedback, they can help you operationally. When we ask the survey, and when we ask for the review, we see varied types of responses as far as what they're actually asking for. Sometimes they'll even comment on the website, which isn't specifically what we were asking them about. And so there's good and bads to this. I would say the good is people are responding to their general feeling of the experience that they had. And the bad is sometimes people can focus on just one negative thing and not the overall experience. So what we love to see is someone give us a 5-star review because they had an overall good experience, but hey, this is something you can improve for next time. And that's kind of the best of both worlds, because we still get the positive review. We also get some constructive feedback that we can take and hopefully improve our service in the future.
Yeah, one thing I would add to that, Jay, is as we collect such a large quantity of reviews, right, and as you're, I guess, open up the floodgates, so to speak, like we talked about earlier, that's really when you start to see valuable sentiment coming through in those patient reviews. So that's when we can provide, the sentiment analysis needed to look at, all right, how across 20, 30 different categories, how are they relating wait time to their overall experience, or how are they relating the front desk or the billing experience, or what have you. Like there's several different types of feedback they provide that can be analyzed and attributed to different rankings that they give. So definitely something that we're focused on, and in capturing and also in portraying and making sure that it's available to the system to be able to improve over time.
Yeah.
Thank you both for weighing in there. And this next one isn't so much a question as it is a comment, but I think it gets to something that I think would be important to discuss, and I'd love to hear what you think about it. So the comment is maybe the negative bias is really reflection of the actual patient experience. In our disconnected healthcare system, the default is just that, disconnected. So I guess the attendee is suggesting that this is where that negative experience comes from. Does that track with each of you? Does that comment sort of reflect how you see this reality?
I would say it doesn't reflect my experience. And again, one guy at one company. To me, and again, for us, and the reason I say no is we were seeing a disconnect between what Google was saying and what our survey process was saying. So now we had to look at our survey process and say, is our survey process scientific? Is it accurate? And believe me, we went through those processes as well, because it's very easy to create a survey process if you're not careful that will just tell you what you want to hear and give you, just be an echo chamber for good things. But that's not giving you an accurate picture. Now, what I will identify with is there is a negative bias for different visit types. If you've got someone who's coming into an emergency room with a serious injury and they're in pain, that's a negative experience, right? That's not the same thing as, I went to Key West and stayed at the Waldorf, to use two extreme examples. So that part, I do agree, there is there can be a negative bias, depending on why the patient's there. If the patient gets bad news from a diagnosis, that's a negative experience, even if the health provider has done everything that they should do. There can be some negative. So from that perspective, I certainly agree. People aren't leaving, often when you're seeing them as a health provider, you're getting them at a low point, right? No one's coming to a healthcare provider just for fun. So that part, I would certainly agree with, that there can be negative bias just because of the nature we're in versus, say, maybe a retail setting.
Some great points there, Jay. Thank you for addressing that and your candid response there. The next question then we'll take is, the attendee asks, we learned today that Google algorithms favor providers who respond to reviews. How can we respond to reviews in a HIPAA-compliant way without sounding bland, robotic, or insincere?
So
that's a great question.
Yeah,
sorry, go for it, Jay. All right. Yeah, there's a bit of a delay on my audio. I apologize. It's a great question. Obviously, HIPAA compliance is crucial. One thing to keep in mind here is that these particular visitors or patients of your healthcare system logged into their own review account, left the review on Google, and posted it, right? So it is something that they chose to do of their own accord, but it's not up to you to decide what feedback they give. It's up to us to decide how we can respond. So I think there is a bit of, when you do respond to these reviews, I think you do have to be a bit careful of the way that you respond and tactful. So one thing that often, we see health systems implement here is certain, a number of 20, 30 templated responses that provide a bit of a HIPAA compliant buffer there to make sure that you can respond in a way that is a bit intentional and rote, but also something that still provides some help there. So that's one of the ways that we've seen it done. We've also seen, obviously, that these organizations make sure that the person or people that are responsible with responding to these reviews are HIPAA certified and do have, the training and know-how to be able to respond to these reviews in a HIPAA compliant way.
Yeah, and I'll just add, this is something that's important to us, that you are being empathetic to the patient and being cognizant of them taking their time to share their feedback, even though it may be negative. And that's why for us, one, make sure the person who's responding is trained in HIPAA compliance and responding responding best practices, and also, and I mentioned it before, try to take it offline. Give them a way. You're not just trying to pat them on the head and say move along. We really want to solve that problem for them, and we'll direct them to the right person that can do that. In our case, it's not the person responding to the review. That's not the person that can make it right necessarily, but they are the person that can get them pointed in the right direction, and we try to make sure we do that.
Great, thank you both. That's an important question to tackle, and this next question sort of gets at, I think you both come at this from various angles throughout this conversation, but I think this question gives another opportunity to sort of revisit some of the stuff you've already shared with attendees. So the attendee asks, how are hospitals able to get or encourage more feedback from patients?
I guess I'll take a first stab at this. I mean, I think it's through asking. So obviously there's going to be required surveys that you have to send out, like HCAHPS, for example, right? There are surveys that you need to be sending, and those are more lengthy. You're going to see a smaller percentage of responses there, but obviously those are critical, and you receive info per department, et cetera. So we're not saying to stop doing those sort of things. What we are saying, though, is encourage these light touch points where you can receive valuable patient feedback that not only help you internally, given that the quantity of responses that you receive, but also help you externally, right? They actually help your brand show up more on Google, right? I mean, on average, you're going to see an increase of sometimes almost 50% or more in terms of the amount of views that your listings receive on Google per location and per physician, which is critical in the overall patient journey and experience. Because again, when a patient searches, we want to make sure that they see the truly highest rated in their areas so that they know where to go with their care, and they have realistic expectations going in. So that would be my response is you just need to make sure that you ask them. I think there's ways to do it that are light and effective, and then there's ways to do it that are a bit not necessarily intrusive but annoying, right? And obviously I think Jay mentioned a phone call can get a bit annoying versus a quick text message, right? So there's different methods to go about doing it. What we've found, at Podium in doing this in the largest healthcare organizations in the world is it's been the most impactful. We've seen the highest conversion rate as well as the best satisfaction rate through collecting these via text message with a quick link. No extra questions, just, would you leave us a review on Google? They click the link, or would you leave us a review, period? They click the link, and they can either leave it on Google or Healthgrades or somewhere else, right?
Thanks for tackling that one, Brian. The next question we'll take sort of circles back to some of what we were just talking about around HIPAA compliance. So this gets a little bit more specific, though. So the attendee asked, one of the challenges in managing online reviews for healthcare providers is the issue of HIPAA compliance when responding to reviews. Can you talk a little bit about best practices for how to appear responsive to reviews while not confirming a reviewer was a patient, family member, etc.? I've heard that even liking a person's review can be viewed as an affirmation that the person was a patient or received a healthcare service.
Brian, you want to take that?
Yeah, for sure. So yeah, the person that asked this question, it sounds like they've talked to the legal team and have had some interesting conversations there. I think to be honest, we've actually seen quite a differing of opinion, the different legal teams that we talk to. So I think there's definitely a gray area here. Partly, I mean, HIPAA was created before Google reviews really existed, right? So that's definitely part of it. But what I will say is this. there are ways that you can respond to reviews without personalizing the message. And even something as simple as, sorry to hear, please give us a call, or something as simple as, thanks so much for the review, we appreciate it. Something like that is very basic, but it goes a long way for the patient to feel like they're heard. Number one, that they actually did have a voice and that it is acknowledged. And then two, being able to make sure that you don't confirm patient data necessarily online, right? So that's typically what we see. Again, we see a lot of templated responses created that have been screened by their legal team. A lot of larger health systems go that route. And a very, very few that we've implemented have opted to just not respond to reviews. So they've opted to say, all right, we can tackle 3 of the 4 things. What we don't want to do, though, is just ignore that Google reviews exist, because our legal team doesn't really want us to respond to them. So what they do is they still take the approach of collecting a large quantity of reviews, making sure that that rating is as positive as they can get it through collecting those reviews, and then allowing that to be a positive uptick in their ultimate Google ranking. So there's different approaches. I would say definitely consult with your legal team. But what we see most often is that there are templated responses that people receive approval from, as well as individuals that have received training to then respond to reviews.
Yeah, and just to add one thing to that, Brian, that you hit on was the wording matters. So you could say to them, thank you for your review, or thank you for your feedback, rather than thank you for your visit. Those types of things can help differentiate between, because you're thanking them for what they initiated, the contact that they initiated, and not confirming that they saw you on a certain date. What we found also is, and I think this is a good thing, a lot of times the person's identity is hidden. If you see my Google reviews, you'd never connect my Google name with me. And so sometimes there's a lot of times that anonymity helps. So it even though people can be trained on not responding specifically, that anonymity can help make sure that doesn't happen, because not only is a person not responding specifically because they've been trained not to, but also they don't know what the specifics are of that scenario. But yeah, I agree with Brian, consult with legal, make sure that, that those I's are dotted and T's are crossed.
Thank you both for tackling that. With just a couple minutes left here, we might have time for just one more question, but we've had a ton of great engagement from attendees, so really appreciate it. The question we'll take is then, the attendee asks, when it comes to reviews for specific physicians hosted on the healthcare organization's site, I think many people are rightly skeptical about 5-star ratings across the board. What is your take on pruning reviews before publishing? And how do you still instill greater confidence in being able to trust those types of reviews?
Yeah, maybe I'll take this first, and then Jay, you can weigh in. Does that work? Okay.
Yeah.
So what I would say is first off, the first thing that they're going to see is a third-party listing, likely Google or Healthgrades or Vitals or WebMD, before they go to your website and actually see the physician rating. So I would say the first thing is you've got to solve the digital front door battle initially. And in that case, I would definitely say and recommend do not screen those reviews. Like I think one of the pitfalls that marketing teams and just healthcare organizations in general run into is trying to gate those reviews, or trying to say, I only want 4 stars and above to be posted. Like that is where I think transparency matters. We truly believe in it. And so I would definitely recommend not filtering out negative reviews. I think passing them through to leave a review wherever they want to post it, whether it's Google or wherever, I think that's critical. And then the second thing I would say is, definitely there's going to be reviews posted on your site. There's going to be, reviews that are posted on your physician pages, most likely in a Find a Doc setting or something like that. And you're right, consumer trust for reviews that live on your website are different than how they trust reviews that live on Google, just simply because of the way that it's being communicated. So my belief and the way that I view it is the more transparent, the better. So if that physician really does have a 5-star rating, it's not only going to show on your website, it's also going to show up on Google, right? And if that physician has a 2-star rating on Google and a 5-star rating on your website, then yeah, I think there is definitely a problem there that needs to be addressed. What would you say, Jay?
Yeah, I agree. If you're going to be pruning, I'd be very careful with that because it's easy to spot. People are going to, by the time they get to your website, they will already have seen at least get an overall impression of the facility, at least, maybe not a specific doctor. And if there's a disconnect, you're going to have a loss of trust. So you got to be careful with those. I would say you either choose to show them on your on your internal your website and show them mostly as is. It's okay to highlight positive ones, right? But if the only thing they see is the positive ones and then your Google rating is 3.0, there's just not a lack of transparency there, and you're going to lose trust with the patient.
Some really important comments to close on there. So, Brian, Jay, it's been a great conversation. Really appreciate both of you joining me for this. Also, just want to thank our attendees today. Great engagement from them as well. And I'd also like to thank Podium for sponsoring today's webinar. So, to learn more about the content presented today, please check out the resources section on your webinar console, and please fill out the post-webinar survey. Thank you for joining us today. We hope you have a wonderful afternoon.
Thanks, everybody.
Thank you, guys.